Ever wonder about an ache or pain you're feeling? Well, you can ask Dr. Sean Riley about it. Let's answer one of those questions sent in this month to Dr. Riley and his team. Dr. Riley, a website visitor is asking, my primary care physician recommends conservative care for my low back pain. What exactly does that mean?
Yes, Scott. So obviously, primary care physician is our family physician, the one that we see throughout the year for aches and pains and common colds and so forth. And a lot of times, I answered this question with this guy last week, but patients will come in and they're just confused because they go to their physician, their primary care doc, and with neck or low back pain, and he recommends conservative care, and they just kind of look at me like, what in the heck is conservative care? So obviously, conservative care is what it sounds like. We're not going to use surgery or something invasive. Okay. We're going to manage it conservatively. And so typically the front or the first line of defense from your primary care physician, let's just assume that it's just generalized neck pain or low back pain. Obviously nothing too terribly serious. They're going to recommend maybe a medication, and we're going to see typically anti-inflammatories to deal with the inflammation, maybe some type of muscle relaxant to help it relax a little bit. And then in some instances, a narcotic or a pain medication that, will help us get through that acute or symptomatic phase. So the goal with, initially with any type of complaint, I'll go back to it that we want to properly diagnose it and determine what the problem is. And then from there, recommended treatment plan. So that's typically what we're going to see. First line of defense is some type of medication management. Okay. And then that's when they're going to end up in our office. Conservative care could include chiropractic therapy and physical therapy. And we'll address those couple things since that's two of the biggies here at Tulsa Spine and Rehab. We want to sit down and figure out what is the patient, what they're doing, what are some of the aggravating factors, and make, recommendations. We might call them self-management strategies. We might make recommendations to modify their activity, different things that they can make themselves feel better, even, self-treatment options, or avoid those things that potentially could be harmful or dangerous, or more importantly, just, that increases the pain.
Does conservative care necessarily mean long-term treatment?
Not at all. I mean, sometimes conservative care might mean just a 3 or 4 day course of medication management with some, some self-management strategies and maybe a couple stretches. That's a really, really good question. I think sometimes when we get we hear conservative, we're like, oh gosh, that's going to drag out forever. Back on, recommendations, stretching, exercise, those are two biggies as well. And those are recommendations that we'll make to patients that, that those are things that they can do on their own. I've talked in the past on a pedometer segment we did, activity, keep moving, different things like that. And then chiropractic care focuses on joint mobilization, soft tissue mobilization, adjustments, manipulation. And then, here in the clinic, physical therapy is a huge part of what we do. Determine if there's some stability issues or some weaknesses. A lot of times it's about education too, just educating a patient on what they need to be doing. And a visit with us, they might see us twice and that's it. Other forms of conservative care, which are a little more invasive, we've heard about epidural steroid injections. You'll go to a specialist such as a board-certified pain management specialist, an anesthesiologist, that will put a little bit of medicine in the disc or in a joint under fluoroscopy. That means X-ray. It's an outpatient procedure. It takes all of about 10 or 15 minutes, and you're home doing what you need to do later that day. That's another form of conservative care. Very, very effective for low back and neck problems as well.
I would imagine a recommendation of conservative care is largely dependent upon the level of pain someone's feeling. If they're in pain, they're probably not going to go that route.
Well, yeah, and conversely to that, though, it's, sometimes the level of pain dictates what we want to do, and that's why the medications sometimes, when you check in with your primary care physician or your family physician, that it's, let's get through that symptomatic or that acute or that very painful, phase, and we can transition you into more active care. So we'll talk about two different kinds of care: passive care, which means you're not going to do much of as a patient. You might be taking medications or have a procedure done, and then we want to, if indicated, progress more to an active care where you're actually doing some things. You're exercising again. You're stretching. You might be performing a specific, protocol or routine that someone's recommended. So pain is going to be it's an indicator, and it's going to be a complicating factor sometimes. But if we can kind of get you through that symptomatic phase as quickly as possible, then we can start getting involved more in active type care.
If you'd like to ask Dr. Riley a question, it's easy. You'll find a submission form there on the right-hand side of the webpage, or you can email info@tulsaspineandrehab.com.